Welcome to Educlex NCLEX RN 2026 practice. This video contains 25 challenging original questions. Listen to each question and its options, then use the 25-second countdown to choose your answer. After each question, review the correct response and detailed rationale. Let us begin. Question 1. The charge nurse receives report on 4 clients. Which client should the nurse assess first? Here are the options. Option A. A client 1 day after hip arthroplasty reporting pain of 7 out of 10. Option B. A client after carotid endarterectomy with new difficulty speaking. Option C. A client with heart failure awaiting discharge teaching. Option D. A client with pneumonia whose temperature is 38.1 degrees Celsius, 100.6 degrees Fahrenheit. Your 25-second thinking time starts now. The correct answer is B. A client after carotid endarterectomy with new difficulty speaking. Here is the rationale. New difficulty speaking after carotid endarterectomy may indicate acute cerebral ischemia, embolization, or compromised cerebral perfusion. This time-sensitive neurologic change requires immediate assessment and rapid escalation. Severe postoperative pain needs treatment, but it is not as immediately threatening as a new focal deficit. Discharge teaching can wait, and a low-grade fever is expected to be evaluated after the unstable client. Exam takeaway. Prioritize an acute change in neurologic status over expected or non-urgent findings. Question 2. Which task is most appropriate for the RN to delegate to experienced unlicensed assistive personnel, UAP? Here are the options. Option A. Teach a client newly prescribed warfarin about bleeding precautions. Option B. Evaluate whether IV morphine relieved a postoperative client's pain. Option C. Obtain and record a daily weight for a stable client with heart failure. Option D. Assess a client's dizziness when standing for the first time after surgery. Your 25-second thinking time starts now. The correct answer is C. Obtain and record a daily weight for a stable client with heart failure. Here is the rationale. Obtaining a routine daily weight on a stable client is predictable, has a standard procedure, and does not require nursing judgment. The RN remains responsible for interpreting the trend. Initial teaching, evaluation of medication effectiveness, and assessment of a new symptom require the RN's knowledge and clinical judgment, and therefore cannot be delegated to UAP. Exam takeaway. Delegate routine, predictable tasks, retain assessment, teaching, and evaluation. Question 3. Which client is most appropriate for the RN to assign to an LPN or VN? Here are the options. Option A. A newly admitted client with chest pressure requiring an initial assessment. Option B. A stable client with a chronic tracheostomy needing routine tracheostomy care. Option C. A client beginning a first blood transfusion. Option D. A client with newly diagnosed diabetes requiring initial insulin teaching. Your 25-second thinking time starts now. The correct answer is B. A stable client with a chronic tracheostomy needing routine tracheostomy care. Here is the rationale. A stable client requiring a routine procedure with an established plan of care is appropriate for an LPN or VN. The RN should perform initial assessments, care for potentially unstable clients, initiate and monitor high-risk therapies such as a first blood transfusion, and provide initial comprehensive teaching. Scope can vary by jurisdiction and policy, but stability and predictability remain central assignment principles. Exam takeaway. Assign stable, predictable care to the LPN or VN. Keep unstable and initial care needs with the RN. Question 4. A client is preparing to sign consent for surgery. Which actions are appropriate for the nurse? Select all that apply. Here are the options. Option A. Witness the client's signature and verify it is voluntary. Option B. Explain all surgical risks if the client asks for clarification. Option C. Notify the surgeon if the client has unanswered questions. Option D. Use a qualified medical interpreter when needed. Option E. Ask the family to sign when a capable client appears anxious. Your 25-second thinking time starts now. The correct answers are A, C, and D. Here is the rationale. The nurse may witness the signature, confirm that the client is acting voluntarily, and facilitate communication with a qualified interpreter. The provider performing the procedure is responsible for explaining its nature, risks, benefits, and alternatives. Unanswered questions should be referred back before signing. Anxiety alone does not remove decision-making capacity, and family cannot replace a capable client's consent. Exam takeaway. The nurse witnesses and advocates. The procedural provider obtains informed consent. Question 5. The nurse realizes that a client received twice the prescribed dose of an antihypertensive 15 minutes ago. What is the nurse's first action? Here are the options. Option A. Complete an occurrence report. Option B. Notify the prescribing provider. Option C. Assess the client's blood pressure, pulse, and level of consciousness. Option D. Ask the pharmacist to calculate the drug's half-life. Your 25-second thinking time starts now. The correct answer is C. Assess the client's blood pressure, pulse, and level of consciousness. Here is the rationale. Client safety comes first. The nurse should immediately assess for actual or emerging harm and obtain relevant vital signs and neurologic status. The provider and appropriate chain of command are then notified, treatment and monitoring orders are implemented, and an occurrence report is completed according to policy. Documentation in the health record should describe the client's condition and care, not reference the occurrence report. Exam takeaway. After an error, assess the client first, then notify, treat, document, and report. Question 6. Which interventions are appropriate for a hospitalized client with symptomatic Clostridioides difficile infection? Select all that apply. Here are the options. Option A. Wear a gown and gloves when entering the room. Option B. Use alcohol hand rub as the preferred method after care. Option C. Wash hands with soap and water after care. Option D. Use dedicated client care equipment when possible. Option E. Clean the environment with an effective sporicidal product. Your 25-second thinking time starts now. The correct answers are A, C, D, and E. Here is the rationale. C. difficile form spores that are not reliably removed by alcohol hand rub alone. Contact precautions require gown and gloves, and soap and water hand washing physically remove spores. Dedicated equipment reduces cross-transmission, while an EPA-registered product effective against C. difficile spores is used for environmental disinfection according to facility policy. Alcohol rub can be used in some workflows, but it does not replace soap and water after caring for this client. Exam takeaway. 4C difficile, contact precautions, soap and water, dedicated equipment, and sporicidal cleaning. Question 7. The nurse suspects measles in a client with fever, cough, conjunctivitis, and a spreading rash. Which actions are appropriate? Select all that apply. Here are the options. Option A. Place the client in an airborne infection isolation room. Option B. Wear a fit-tested N95 or higher-level respirator. Option C. Use only a surgical mask because measles uses droplet spread. Option D. Limit transport and mask the client if transport is essential. Option E. Keep the room door open to improve observation. Your 25-second thinking time starts now. The correct answers are A, B, and D. Here is the rationale. Measles requires airborne precautions. The client belongs in an airborne infection isolation room with the door closed, and staff use a fit-tested N95 or higher-level respirator according to policy. Transport should be minimized. When essential, the client wears a surgical mask if tolerated. A surgical mask alone does not adequately protect staff entering the room. Exam takeaway. Measles is airborne. Negative pressure isolation, respirator protection, and limited transport. Question 8. While preparing a sterile dressing change, the nurse's sterile glove touches the bed rail. What should the nurse do next? Here are the options. Option A. Continue because the bed rail was disinfected earlier. Option B. Wipe the glove with an antiseptic pad. Option C. Consider the glove contaminated and replace it before continuing. Option D. Ask an assistant to hold the contaminated hand away from the field. Your 25-second thinking time starts now. The correct answer is C. Consider the glove contaminated and replace it before continuing. Here is the rationale. A sterile item that contacts a non-sterile surface is contaminated. The nurse should stop, remove the contaminated glove without contaminating the remaining field, perform hand hygiene as indicated, and don a new sterile glove before proceeding. Surface disinfection does not make a bed rail sterile, and wiping a glove cannot restore sterility. Exam takeaway. When sterility is in doubt, treat the item as contaminated and replace it. Question 9. A client at 32 weeks gestation calls the clinic. Which report requires immediate evaluation? Here are the options. Option A. Mild ankle swelling at the end of the day. Option B. Urinary frequency without pain or fever. Option C. Severe headache with visual spots and right upper quadrant pain. Option D. Occasional irregular contractions that stop with rest. Your 25-second thinking time starts now. The correct answer is C. Severe headache with visual spots and right upper quadrant pain. Here is the rationale. Severe headache, visual disturbance, and right upper quadrant or epigastric pain are warning signs of severe preeclampsia and possible hepatic involvement. The client needs prompt maternal and fetal assessment. Dependent ankle edema, uncomplicated urinary frequency, and irregular contractions that resolve with rest may occur during pregnancy, though they should still be discussed during routine follow-up. Exam takeaway. Neurologic symptoms or upper abdominal pain in late pregnancy can signal severe preeclampsia. Question 10. Which parent statement shows correct understanding of safe sleep for a healthy 2-month-old infant? Here are the options. Option A. I will place my baby on the back on a firm, flat sleep surface. Option B. I will use a sleep positioning wedge to prevent rolling. Option C. A soft blanket is safe if it is tucked tightly under the mattress. Option D. Side lying is safest after feeding. Your 25-second thinking time starts now. The correct answer is A. I will place my baby on the back on a firm, flat sleep surface. Here is the rationale. A healthy infant should be placed supine for every sleep on a firm, flat, approved sleep surface with no loose bedding, pillows, positioners, or soft objects. Side lying is unstable and may allow the infant to roll prone. Positioning wedges and soft bedding increase entrapment or suffocation risk and are not recommended for routine infant sleep. Exam takeaway. Back to sleep, firm and flat surface, empty sleep space. Question 11. A client with major depression says, "My family would be better off without me." What is the nurse's best response? Here are the options. Option A. Your family would be devastated, so try not to think that way. Option B. Are you thinking about killing yourself? Do you have a plan or access to the means? Option C. Why would you want to hurt the people who care about you? Option D. Let's discuss something positive that happened this week. Your 25-second thinking time starts now. The correct answer is B. Are you thinking about killing yourself? Do you have a plan or access to the means? Here is the rationale. The statement is a suicide warning sign. The nurse should ask directly and calmly about suicidal thoughts, plan, intent, timing, and access to lethal means, then institute safety measures based on risk. Direct questioning does not create suicidal ideas. Reassurance, guilt, why questions, or changing the subject can shut down communication and delay a life-saving assessment. Exam takeaway. Ask directly about suicide, plan, intent, timing, and means, then protect the client. Question 12. Which interventions are appropriate for a client experiencing acute mania? Select all that apply. Here are the options. Option A. Provide high-calorie finger foods and fluids. Option B. Use brief, clear directions, and consistent limits. Option C. Schedule competitive group activities to release energy. Option D. Reduce environmental stimulation. Option E. Build rest periods into the daily schedule. Your 25-second thinking time starts now. The correct answers are A, B, D, and E. Here is the rationale. Acute mania produces hyperactivity, poor concentration, reduced sleep, and inadequate intake. Portable high-calorie foods, hydration, a low stimulation setting, brief directions, consistent boundaries, and structured rest support safety and physiologic needs. Competitive or highly stimulating activities can intensify agitation, distractibility, and conflict. Exam takeaway. Lower stimulation, set calm limits, protect sleep, hydration, and nutrition. Question 13. A client is admitted after an acute stroke and asks for water. What should the nurse do first? Here are the options. Option A. Offer small sips through a straw. Option B. keep the client NPO until swallowing is screened. Option C, thicken the water to a nectar consistency. Option D, place water at the bedside and encourage slow drinking. Your 25-second thinking time starts now. The correct answer is B. Keep the client NPO until swallowing is screened. Here is the rationale. Stroke can impair swallowing and cause silent aspiration. Oral food, fluid, and medication should be withheld until the client passes an appropriate swallowing screen or receives further evaluation. A straw or empirically thickened liquid is not automatically safe and may worsen aspiration for some swallowing patterns. The prescribed consistency and strategies should follow assessment findings. Exam takeaway. After acute stroke, screen swallowing before anything is given by mouth. Question 14. Which interventions help prevent pressure injury in an immobile adult? Select all that apply. Here are the options. Option A, reposition on an individualized schedule. Option B, float the heels off the mattress. Option C, massage persistently reddened bony areas. Option D, manage moisture and promptly cleanse incontinence. Option E, assess nutrition and provide prescribed support. Your 25-second thinking time starts now. The correct answers are A, B, D, and E. Here is the rationale. Pressure prevention combines regular repositioning based on risk and tolerance, heel offloading, moisture control, skin inspection, and adequate nutrition and hydration. Persistently reddened tissue may already be injured. Massaging it can increase friction and damage fragile capillaries. Prevention plans should be individualized rather than relying on one rigid turning interval for every client. Exam takeaway. Offload pressure, control moisture, support nutrition, and never massage non-blanching redness. Question 15. A client receiving unfractionated heparin has a platelet decrease from 240,000 a cubic millimeter to 96,000 a cubic millimeter on day 6. What action is the priority? Here are the options. Option A, administer protamine sulfate immediately. Option B, stop all heparin products and notify the provider. Option C, reduce the heparin infusion by half. Option D, transfuse platelets before stopping heparin. Your 25-second thinking time starts now. The correct answer is B, stop all heparin products and notify the provider. Here is the rationale. A platelet fall greater than 50% occurring 5 to 10 days after heparin exposure strongly suggests heparin-induced thrombocytopenia, a prothrombotic emergency. Stop every source of heparin, including flushes, and notify the provider so testing and a non-heparin anticoagulant can be considered. Protamine treats heparin's anticoagulant effect, not the immune process. Routine platelet transfusion can worsen thrombosis unless there is significant bleeding or another specific indication. Exam takeaway. Suspected HIT, stop all heparin, not merely the infusion, and anticipate non-heparin anticoagulation. Question 16. A client with diabetic ketoacidosis has glucose 520 mg per deciliter, 28.9 millimoles per liter, and potassium 3.1 milliequivalents per liter. Which prescription should the nurse question? Here are the options. Option A, begin isotonic IV fluid replacement. Option B, start a continuous IV regular insulin infusion now. Option C, place the client on continuous cardiac monitoring. Option D, administer IV potassium replacement as prescribed. Your 25-second thinking time starts now. The correct answer is B, start a continuous IV regular insulin infusion now. Here is the rationale. Insulin shifts potassium into cells and can cause a lethal dysrhythmia when serum potassium is already severely low. In DKA with potassium below the usual safe threshold for insulin, potassium replacement and monitoring are started first, while fluid resuscitation continues. Insulin is delayed until potassium improves. Cardiac monitoring is appropriate because both DKA and potassium replacement can produce rapid electrolyte changes. Exam takeaway. In DKA, correct severe hypokalemia before starting insulin. Question 17. Before giving Digoxin, the nurse finds an apical pulse of 52 per minute. The client reports nausea and yellow-green halos. What should the nurse do? Here are the options. Option A. Give Digoxin with food to reduce nausea. Option B. Hold Digoxin and notify the provider. Option C. Give the dose and recheck the pulse in 1 hour. Option D. Administer an antacid before the medication. Your 25-second thinking time starts now. The correct answer is B, hold Digoxin and notify the provider. Here is the rationale. Bradycardia, gastrointestinal symptoms, and color or halo visual disturbances are classic findings of possible Digoxin toxicity. The nurse should hold the medication, notify the provider, and anticipate serum Digoxin, potassium, and renal function evaluation. Giving the drug could worsen conduction abnormalities. Food or an antacid does not address the suspected toxicity and may delay care. Exam takeaway. Suspect Digoxin toxicity when bradycardia occurs with gastrointestinal or visual changes. Question 18. A client with severe preeclampsia receives magnesium sulfate. Which findings require stopping the infusion and urgent action? Select all that apply. Here are the options. Option A, respiratory rate 10 per minute. Option B, absent patellar reflexes. Option C, urine output 20 milliliters during the last hour. Option D, blood pressure 150 out of 94 millimeters of mercury. Option E, 2+ dependent ankle edema. Your 25-second thinking time starts now. The correct answers are A, B, and C. Here is the rationale. Magnesium is excreted by the kidneys. Oliguria promotes accumulation, while loss of deep tendon reflexes and respiratory depression signal toxicity. Stop the infusion, support airway and breathing, notify the provider or rapid response team, and prepare calcium gluconate according to protocol. Hypertension reflects the underlying preeclampsia, and dependent edema alone is not a specific sign of magnesium toxicity. Exam takeaway. Magnesium toxicity, falling respirations, absent reflexes, and reduced urine output. Question 19. 4 hours after thyroidectomy, a client develops inspiratory stridor and increasing restlessness. What is the nurse's priority action? Here are the options. Option A, reassure the client that hoarseness is expected. Option B, apply oxygen and activate emergency airway assistance. Option C, check the serum calcium level before intervening. Option D. Offer ice chips and place the client flat. Your 25-second thinking time starts now. The correct answer is B. Apply oxygen and activate emergency airway assistance. Here is the rationale. Stridor after neck surgery indicates critical upper airway narrowing from edema, hematoma, or laryngeal compromise. Oxygen, immediate emergency assistance, and preparation for advanced airway management are priorities. The neck and dressing should be rapidly assessed without delaying airway care. Calcium assessment matters if hypokalemia is suspected, but it does not come before treatment of an obstructed airway. Exam takeaway. Post-thyroidectomy stridor is an airway emergency, not routine hoarseness. Question 20. After a femoral cardiac catheterization, the nurse sees bright red blood rapidly saturating the groin dressing. What should the nurse do first? Here are the options. Option A. Apply firm manual pressure at the puncture site. Option B. Elevate the head of the bed to 90 degrees. Option C. Remove the dressing to measure the blood loss. Option D. Ambulate the client to improve circulation. Your 25-second thinking time starts now. The correct answer is A. Apply firm manual pressure at the puncture site. Here is the rationale. Active arterial bleeding can cause rapid blood loss. The nurse should apply firm manual pressure immediately while summoning help and assessing vital signs, distal circulation, and possible retroperitoneal bleeding. The affected leg is kept straight and the client remains supine as indicated. Sitting upright, removing pressure, or ambulating can worsen hemorrhage. Exam takeaway. Visible femoral-site bleeding, pressure first, then escalate and assess circulation. Question 21. 10 minutes after packed red blood cells begin, a client develops chills, low back pain, and dyspnea. What is the nurse's first action? Here are the options. Option A. Slow the transfusion and reassess in 5 minutes. Option B. Stop the transfusion. Option C. Administer prescribed acetaminophen. Option D. Flush the blood tubing with dextrose solution. Your 25-second thinking time starts now. The correct answer is B. Stop the transfusion. Here is the rationale. The symptoms suggest an acute transfusion reaction. Stop the blood immediately to prevent further antigen exposure. Keep IV access open with 0.9% saline through new tubing. Assess airway and vital signs. Notify the provider and blood bank, and follow the reaction protocol. Do not merely slow the blood, and do not flush remaining blood in the tubing into the client. Exam takeaway. Suspected transfusion reaction. Stop the blood first. Maintain IV access with normal saline using new tubing. Question 22. A client with suspected infection has BP 82 out of 46 mm of mercury, lactate 4.6 millimoles per liter, warm skin, and confusion. Which action should the nurse prioritize while the sepsis bundle is mobilized? Here are the options. Option A. Begin rapid IV balanced crystalloid resuscitation. Option B. Give an antipyretic and reassess in 30 minutes. Option C. Restrict fluids to prevent pulmonary edema. Option D. Wait for final culture results before antibiotics. Your 25-second thinking time starts now. The correct answer is A. Begin rapid IV balanced crystalloid resuscitation. Here is the rationale. The client has septic shock with hypoperfusion. Resuscitation begins immediately. Current sepsis guidance supports prompt IV crystalloid, with balanced crystalloids generally preferred, while cultures, broad antimicrobial therapy, lactate reassessment, source control, and vasopressor preparation proceed without avoidable delay. Antipyretics do not reverse shock. Routine fluid restriction is unsafe during initial hypoperfusion, and treatment should not wait for final cultures. Exam takeaway. Septic shock is a medical emergency. Restore perfusion and deliver timely antimicrobial care in parallel. Question 23. A mechanically ventilated client suddenly becomes hypertensive. The right chest has no breath sounds, the trachea shifts left, and peak airway pressure rises. What intervention is expected immediately? Here are the options. Option A. Needle or finger decompression of the right chest. Option B. A routine portable chest radiograph before treatment. Option C. Endotracheal suctioning for 15 seconds. Option D. Trendelenburg positioning and a fluid restriction. Your 25-second thinking time starts now. The correct answer is A. Needle or finger decompression of the right chest. Here is the rationale. Sudden unilateral absent breath sounds, tracheal deviation away from the affected side, rising airway pressure, and shock indicate tension pneumothorax. This is a clinical diagnosis requiring immediate decompression, followed by definitive chest tube placement. Waiting for imaging can cause cardiac arrest. Suctioning does not relieve trapped pleural air, and positioning cannot correct the obstructive shock. Exam takeaway. Treat tension pneumothorax immediately. Do not delay decompression for imaging. Question 24. A client with diabetic ketoacidosis is receiving IV fluids and insulin. Which finding best indicates that treatment is resolving the ketoacidosis? Here are the options. Option A. Blood glucose decreases to 210 mg per deciliter, 11.7 millimoles per liter. Option B. Serum bicarbonate rises and the anion gap closes. Option C. Urine output increases to 40 milliliters per hour. Option D. Serum sodium increases by 2 milliequivalents per liter. Your 25-second thinking time starts now. The correct answer is B. Serum bicarbonate rises and the anion gap closes. Here is the rationale. DKA resolution depends on correction of ketonemia and metabolic acidosis, reflected by recovery of bicarbonate and closure of the anion gap, not glucose alone. Glucose often normalizes before ketosis clears, so dextrose may be added while insulin continues. Urine output shows perfusion but does not prove the ketoacidosis has resolved, and a small sodium change is not a resolution criterion. Exam takeaway. Follow the acidosis and anion gap, not only the glucose, to judge DKA resolution. Question 25. 20 minutes after a vaginal birth, the client has heavy lochia and a boggy uterus above the umbilicus. What should the nurse do first? Here are the options. Option A. Massage the uterine fundus. Option B. Prepare the client for immediate surgery. Option C. Insert a vaginal packing. Option D. Delay intervention until the quantified blood loss is complete. Your 25-second thinking time starts now. The correct answer is A. Massage the uterine fundus. Here is the rationale. A boggy enlarged uterus with heavy bleeding suggests uterine atony, the most common cause of early postpartum hemorrhage. Immediate fundal massage promotes contraction while the nurse calls for help, assesses circulation, ensures IV access, empties the bladder as appropriate, quantifies blood loss, and prepares uterotonics and additional hemorrhage interventions. Treatment must begin while blood loss is being measured, not afterward. Exam takeaway. Heavy postpartum bleeding plus a boggy uterus. Massage the fundus and activate hemorrhage care. Quiz complete. What was your score out of 25? Review any questions you missed and focus on the safety principle behind each answer. This is independent educational practice content based on the 2026 NCLEX RN test plan. Study smart, think safety first, and keep going with Educlex.